Hello everyone, I am Dr. Mamta Yadav, Assistant Professor from the Department of Pharmacology. I am going to teach you about anti-epileptic drugs. So, as you know, anti-epileptic drug will treat epilepsy. So, before starting what are anti-epileptic drugs, we'll start with what are the epilepsies and what type of epilepsies are there and how we are going to treat the management part and the drugs in detail. So our objective is first to define the epilepsy and the types of epilepsy, then the prototype drug and its management. So coming to the terminologies like epilepsy, it's a chronic disorder of the brain characterized by the recurrent provoked seizures. So approximately 1% of the world population has an epilepsy. And what are seizures? Seizures are proximal, abnormal, excessive high frequency discharge from the brain neurons. And what are convulsions? Convulsions are the major motor manifestation of the seizure. These are basically rhythmic jerks of limbs. So how it occurs? The pathophysiology of the epilepsy. Basically the high frequency of the discharge of impulses comes and they come to the central cerebral neurons, which are mainly due to the alteration in the voltage gated ion channels, reduction in the inhibitory mediators like GABA mediated channels, or increase in the excitatories like glutamate mediated inputs. So these are the pathophysiologies of the epilepsies. Then there are types of epilepsies. As we know, the epilepsies has single syndromes like seizures. Seizures mainly divided into partial seizure and the generalized seizure. As the generalized word says, generalized means seizures activity involve the whole brain. So they have divided into generalized tonic-clonic, which are in short called the GTCS, also called the grand mal epilepsies. Then generalized myoclonic, generalized tonic, atonic, and the absence seizures. And the other major part is the partial seizures. So partial seizures are further divided into simple partial seizure, complex partial seizure, and with the secondary generalizations. So the simple partial seizures activity start in one part of the brain and then it will go to the other involvement of the areas. So the simple seizure activities which will occur in the person when person is alert, and complex activity when the seizure activity will change in the awareness of the surrounding, whereas with the secondary generalization the seizure activity begins in one part and then spread to the other part of the brain. So coming to the etiology, what can be the etiological factor for occurrence of the epilepsy? So majorly we have seen these are the idiopathic. So that means we cannot correlate or we cannot say which particularly is the cause or cause is unknown. And then there are certain congenital defects which lead or precipitate to the epilepsy. Then there are certain injuries like head injury, trauma, hypoxia, which also leads to the epilepsy or seizure. Then infections mainly in the brain, meningeal infections, then brain abscess, and the encephalitis, inflammation of the encephalitis, then the brain tumors. Also certain drug withdrawal will lead to the seizure. Then fever in children, which is called the febrile seizures. Then hypoglycemia and hypocalcemia, reducing the glucose and calcium level, which also lead to the epileptic occurrence. So for the drugs classification, we are going to mainly class according to the mechanism of action. So there is mainly 4 mechanisms of action through which these anti-epileptic drugs are used. So the main is the first is the inhibition of the sodium channel functions, then second is the inhibition of the calcium channel function, then third is the enhancement of the GABA action. Mainly GABA is the inhibitory neurons. So if you enhance the inhibitory neurons, then it will inhibit the neuronal discharge or neuronal activity, which will decrease the seizure action. And then the inhibition of the glutamate release or the blockade of the glutamate receptors. So what are glutamate receptors? Glutamate receptors are the inhibitory receptors. Excitatory receptors. So if you inhibit the glutamate receptor then or block the receptor, then it also lead to inhibition of the neuronal discharge or the decrease the epilepsy or seizure activity. So these are the four main mechanisms. And then in the drugs, basically which prolong the sodium channel inactivation, there are drugs like phenytoin, which is derived from the hydantoin, then carbamazepine, valproic acid, lamotrigine, topiramate, and then zonisamide. And the drug which inhibit the excitatory glutamatergic synapses are phenobarbital, phenytoin, lamotrigine, topiramate, valproate. So valproate also comes in inhibition of the excitatory glutamatergic synapses. Then there is facilitation of the GABA mediated chloride channel opening. These are barbiturates, benzodiazepines, vigabatrin, valproate, gabapentin, and tiagabine. And the fourth one is inhibition of the T-type calcium current. These are ethosuximide, valproate, and zonisamide. So in this we can see there are single drugs which have a multiple mechanism also, like phenytoin, which have a prolongation of sodium channel activation, also inhibition of the excitatory glutamatergic synapses, and then there is valproate, which have a mechanism like inhibition of the sodium channel, also inhibitory of the excitatory glutamatergic synapse, and the facilitation of the GABA mediated chloride opening. Also it inhibits the T-type calcium currents. So valproate has both all the four mechanisms. So we also classify according to the class, like barbiturate has a phenobarbital, then hydantoin has a phenytoin and phosphatoin, then iminosulstilbene has a carbamazepine. So likewise, and there is a newer drugs like topiramate, zonisamide, levetiracetam, vigabatrin, tiagabine. These are introduced recently and have a very good efficacy, and these are also used as an add-on drugs for the for controlling the seizure activity of uncontrolled seizures. So as a prototype drug, we are going to study the phenytoin. Phenytoin basically blocks the axonal sodium channels, and then it will lead to prevent the seizure propagation. So basically they have a sodium inactivation action. Coming to the pharmacokinetic, they have a variable absorption, and the most important point is it follows the zero at a therapeutic dose. It starts with the first autokinetic, and at saturation it follows the zero autokinetics. So this is the highlight of the phenytoin. So this is the reason we also do the therapeutic drug monitoring of the phenytoin, because it follows this saturation kinetic, that is first order to zero order kinetics, and it also have a induction of cytochrome P450. So where does we use? So the indications are mainly the generalized tonic-clonic seizure, which is mainly the drug of choice, then the partial seizure, status epilepticus, trigeminal neuralgia. Trigeminal neuralgia is a non-epileptic use, basically to decrease the pain sensation because of this neuralgia. Then side effects, they have a CNS depressant effect and hirsutism, osteomalacia, gingival hyperplasia, megaloblastic anemia, hypersensitivity, and allergy. So these are the side effects, and contraindications are they should not be given to the myoclonic seizure and the absence seizures. Coming to the carbamazepines, which is also very important drug, it also acts through the sodium related channel. It blocks the sodium channel and prolongs the seizure prevents the seizure propagation and inhibit the epilepsy. So these are where they can be used. They are mainly used in the generalized tonic-clonic seizure, partial seizure, trigeminal neuralgia, mania, bipolar disorders, and also the non-seizure uses in diabetes mellitus insipidus. Okay. Then the side effects are mainly they are acting on the CNS, so they cause CNS depression, osteomalacia, megaloblastic anemia, aplastic anemia. The most important side effect is cleft palate and cleft lip, spina bifida, and allergy. They are also associated with the allergy like Stevens-Johnson syndrome, toxic epidermolysis, necrolysis. And contraindicated, they are not be given in the myoclonic or atonic or absence seizures. And third most, which I have already told you, valproate, which has a all the four mechanism like sodium inhibition, inhibition of the calcium channel current, then prolongation of the glutamate and inhibitor of the glutaminergic pathway. So they have basically used for the all the seizure type like generalized tonic-clonic absence, myoclonic. Also they have been used for the other like in migraine prophylaxis we can give before as the prophylactic to control the migraine, and in the stated applicator is used in the form of the IV. So the side effects we can see the side effect in the name of the mnemonic like valproate. From the V is called the nausea and vomiting, causes the hair loss, alopecia, also the curling of the hair, is hepatotoxic, pancreatitis. It will also lead to pancreatitis if it used for the long duration, and rashes also lead to the obesity, increase ammonia levels in the urine, and it is very important side effect is its teratogenicity. Its teratogenicity should not be given in the pregnant female or in a children, as it will lead to the side effect in the children like the neurological defects. And the thrombocytopenia is also seen with the valproate. So instead of going to details of the other drugs, I should I think emphasize the newer drugs like the vigabatrin. This will basically inhibit the transaminases and used for the treatment of infantile spasm with tuberous sclerosis. So vigabatrin and gabapentin, this is very effective for calcium channel blockers, and is used mainly for the seizure states when the patient is having a seizure activity. Also used for the neuropathic pains and post-herpetic neuralgias to decrease the pain sensations. And the side effects is mainly sedation. So another drug is topiramate, which blocks the sodium channel and glutamate receptors. These receptors are called the AMPA or AMPA and NMDA receptors, and enhances the GABA activity. Also have a mild carbonic anhydrase inhibitor activity. So these are basically used for the focal seizures in children and more than 2 years, and in adults. Also used for the obesity patient to reduce the appetite, and in the migraine prophylaxis, and to decrease the craving in the alcoholic patients. So the another drug is levetiracetam, which has a mechanism of SV2A inhibitors. These are the vesicles releasers. By inhibiting this, there is no release of the neurotransmitters or these agents which sensitize the neurons. So these are used for the focal onset and the generalized tonic seizures, and these are safe in pregnancy. So we can continue if the pregnant lady is taking it and she is controlled on this, then we can continue with the levetiracetam. So coming to the management part, the treatment of epilepsy. As we know, it's the seizure activities can be controlled in episodic manner, and for that we have to maintain the drug concentration. So for any newly diagnosed epilepsy, the first choice of the drug should be the appropriate for the patient. Okay, so consistency, the patient, we should consider toxicity of the agent, and also consider the patient compliance or characteristic of the drug to the patient. So gradually we will titrate the dosage of the to which the maximum tolerated effect can be achieved, or to produce the optimal seizure control. After gradually obtaining the seizure control, we'll see if the seizure is persist or is the patient is seizure free. If the patient is seizure free, then we will not do anything, and if the patient is having a seizure persistent, then we'll go to a second line of the drug. The second drug is then is titrated to a therapeutic level as we have done in the first, and that control the seizures before tapping and discontinuing the original anti-seizure agents. So if the first choice is associated with a significant adverse effect, and then it should be tapered with the second drug. So if there are so much of side effect with the first drug, then we should stop the first drug and then continue with the second drug, and and see if the seizure is stop or is it persistent. If it stop, we'll not give other medication, but if it persisting, then again we have to search the rational combination of the two drug and the alternative drug therapy if the precipitation is still occurring with the drugs. So we can consider the vagal nerve stimulation or the surgeries where the foci is there, through which the seizure is occurring. So these are the treatment guidelines for the epilepsy. And uh, so I think that is also we can classify drug according to the drug for the focal seizures or the drug for the focal seizures and generalized tonic seizures. So the drug of choice for the focal seizures is carbamazepine, oxcarbazepine, and then locosomide, phenytoin, gabapentin, and the drug for the focal seizure and certain generalized onset is lamotrigine, levetiracetam, brivacitram, pramipens. Then there are, we can classify drug according to the seizure type also, like the generalized onset seizure. For the general onset we can give valproate, topiramate. For the generalized absence seizure we can give ethosuximide, valproate. And for the myoclonic epilepsy we can give valproate, topiramate, lamotrigine. So these drugs can also be classified according to the seizure type, and when we can remember that easily. For your easy remembrance, we can classify drug according to mechanism of action or according to the seizure activity that is having. So this is from my side. Thank you very much.